is Dr. Aye here, explaining the essentials of a clinical exam. When you go to the doctor's office, demand that these are done for every medical problem you have. So the doctor is supposed to do a general exam, examine your head and neck, which you talked about. And then I'm going to talk about the cardiovascular system. Your heart sits inside here and it pumps, boom, boom, boom. And the cardiovascular system exam is examining the heart, which is the cardiac, and then the vessels that leave the heart into the brain and the rest of you. So a lot of you have associated a stethoscope with a doctor. You know, the stethoscope is just one piece of thing we use. It's just listening to the heart and the lungs. So a cardiovascular system exam is when the doctor puts the stethoscope on your left side of your chest and listens, and they're looking for the ticking of the heart and abnormal sounds called murmurs. And then they check the right side of both sides of your neck for your carotid pulse, check your groin and also your feet to make sure that blood is pumping. And then another important piece of the cardiovascular exam is the blood pressure. Now, there's a lot I got to say about blood pressure later on. A lot of people don't check their blood pressure, but the blood pressure is extremely important. We'll talk about it in another video. So in a nutshell, cardiovascular system exam is listening to the heart to hear the sounds and make sure that, and you know, if somebody passes out, the first thing people go for is what we call the carotid pulse up here to hear if it's, to feel and see if it's working or the heart is pumping blood to the brain. And so in a nutshell, that's the cardiovascular system. I'll talk about the respiratory system in another video. Thank you.